All right. Hello, everyone. All right. Hello, everyone. Again, good afternoon. I am Gia Rebecca, and I will be your moderator for this session. So, this session is on occupational therapy research. So, make sure that you're in the right room. For this session, we will have three exciting presentations to look forward to. But before we start with our presentations, please allow me to go over our house rules for this parallel session. Each of our speakers will have 15 minutes to present, and this will be followed by 5 minutes of question and answer. But for this session, we're going to have all the questions at the end of our session. So we'll be presenting all three presentations first. You may type your question on the question and answer box on the right side of your screens at any point during the presentation, and then we'll go back to that during our question and answer portion. Please use the Q&A box rather than the chat box for your questions to the speakers. If you also want to speak, please click on raise your hand, also on the right side of your screen, and wait for me to recognize you and to activate your microphone. All right, now, without further ado, let us begin this parallel session on occupational therapy research. Our first speaker is Lynette McKenzie of Australia. Lynette McKenzie is an associate professor at the University of Sydney in the discipline of occupational therapy. This project is the result of a collaboration with Huashan Hospital and Fudan University in Shanghai, China. Her presentation is entitled Celebrating the Diversity of International Occupational Therapy Research, Investing in the Future of the Profession. It is my honor to introduce Ms. Lynette McKenzie. Welcome to this parallel session, Ms. McKenzie. All right. So I will be cueing her video. Mm, right.
My name's Lynette McKenzie, and I'm here to talk about celebrating the diversity of international occupational therapy research, investing in the profession. So I'm presenting this on behalf of a team from the WFOT research program, and this is one of the projects we've undertaken over the last couple of years. We decided to look at the diversity of international occupational therapy research to give WFOT an idea of what is actually going on in the occupational therapy world in terms of the research that's being undertaken. So, as I've said here, the cornerstone of a strong profession is the research that supports its knowledge base and practice. Without a research background, occupational therapy would have great difficulty demonstrating its knowledge base, and practice would not develop as it should alongside other disciplines that have a stronger research base. And we've seen that the published research in occupational therapy has grown rapidly in recent years. So this is the basis for all of our evidence-based practice and knowledge translation into practice. So it's very important that we have a clear idea of the types of research that are being done and the diversity of the research methods that are being used. So the aim of this study was to explore the range and diversity of the international occupational therapy research base, and we used only peer-reviewed literature to assess this. We decided to use a scoping review method so that we could include any types of research that were involved. And we limited our year to 2018, which was the year of the last WFOT Congress. We also limited ourselves to English search engines. And we have decided to review sources from using two methods. One was to use search words associated with occupational therapy, things like participation, rehabilitation, those sorts of words. And then to review all the content pages of all the occupational therapy journals that were available for us to review. So from that process, we came up with 3,459 articles from the keyword search, and 710 articles were published in occupational therapy journals in that year. Of course, there were several duplications. These were removed, and we also removed any studies where we could find no evidence of any of the authors being an occupational therapist. 432 articles are the number that we've got up to so far. So these are the articles that I will be talking about today. We've got quite a way to go to finish the entire list. So out of these 432 articles, 36% of them were published in occupational therapy journals, which means that nearly 2/3 of the articles weren't. So that is an interesting thing to think about. On the one hand, we can promote occupational therapy with other disciplines, but on the other hand, it might not be that easy to see the occupational therapy research that is published elsewhere. Whoops, let's go back. And 24% or 24.5% of the articles used occupational therapy related keywords, things like occupational therapy, occupational science, or occupation. That can be a bit of an issue when nearly 3/4 of the articles we looked at didn't use any sort of keyword related to occupational therapy. So that makes these sorts of searches really difficult. So the first lot of results, we decided to identify which of these articles were related to the WFOT research priorities that were published in 2017. So these are the research priorities on the graph here, and we can see that the most frequent alignment was with evidence-based practice and participation in everyday life, but less common were effectiveness of interventions, aging, community development, technology, and professional issues. I was actually quite surprised that there wasn't as much written about aging or technology, given the current situations that we find ourselves in. So looking at country of origin for these articles, you can see that articles were dominated as coming from North America. We decided to label the country of origin according to the first author of each of the papers, especially when there was a multinational team. So the countries with the highest number of publications are listed below. But you will note, for those of us that are from Asia Pacific, that Asia had a very small representation of the occupational therapy literature. So this may be because things may not have been published in an English-speaking journal, so that's possibly why. But there is an issue that probably we need to be thinking about how to promote research to be published from the Asia Pacific region to improve this. So if we look at the study designs, you can see there's a dominance of cross-sectional research. So that's research conducted at one point in time, and qualitative research and reviews, with less of an emphasis on the more hardcore research designs, such as RCTs, longitudinal or prospective follow-up studies, and mixed methods and retrospective audits, and so on. So that gives you an idea of the flavour of the types of research that is being done in occupational therapy at the moment. And the methods that we used are sort of related again to outcome measurement. So a lot of studies use different outcome measures to come to their conclusions. A lot of studies use surveys, which probably fits in with the cross-sectional nature from the previous slide. And other studies used interviews and thematic analysis, which fits in with the qualitative range of articles. Again, there were a lot less well documented, were more sophisticated types of research that involved statistical techniques, things like factor analysis, rash analysis, Delphi, and structural equation modeling, and other such types of methods. So to conclude, we can safely say that occupational therapy research is very diverse. We'd expect that really, because occupational therapy is very diverse. So we would, as a profession, we need research skills that are across a broad range to be diverse enough to answer the kinds of questions that are needed in occupational therapy practice. Occupational therapy researchers really need to label their research as occupational therapy related, even if you are working in a team and some of the findings might not all be directly related to occupational therapy practice. It's important that there are some keywords in there that might identify the occupational therapy researcher that's part of that project. Another recommendation we have is that it's sometimes very difficult to identify occupational therapy researchers from the types of author information that's available on some publications. So that means it's very important for us when we're actually putting papers in to label ourselves as occupational therapy somehow, even if we have very generic department names like health sciences or rehabilitation sciences or so on. I've started to do that a lot more in the papers that I'm submitting because I'm in a school of health sciences. So I always put occupational therapy in front of that when you have the opportunity to put your affiliation. Some studies don't actually clearly label their study designs or methods. So that's why it was sometimes difficult for us to identify what those were. And we had to delve into the actual methodology to actually find that out, sometimes the results. So that's important to make that very clear. And as I said earlier, there was a dominance of cross-sectional research and survey use, which is good because that needs to be the start of a lot of research questions. But it's important that we don't stop there and that we go on to actually develop those research questions further and to use more important and critically appraisable research methods later on that will lead to a high quality result. And there's also a need for much more research on the effectiveness of occupational therapy interventions. So that requires us really to use more randomized controlled trials in our research for that to be clear. So obviously more longitudinal data helps, but a randomized controlled trial will actually look at the effectiveness of interventions. And maybe health economist approach needs to be thought of as well beside that. And there, as we can see, there is a need for more published research in underrepresented areas of the world. So I think for the Asia Pacific group, this is something that we should really be looking at as a group to find out ways that we can support people to be able to publish their research more easily, especially in English speaking search engines and publications. We hope to go to more non-English search engines later once we've finished this analysis to sort of see what is happening, say, in the Spanish-speaking literature or the Arabic-speaking literature in particular, because there are different search engines available for them, but our research group wouldn't be able to interpret them. So anyway, thank you very much for listening, and I hope that's been helpful for you. Thank you. Goodbye.
All right. Thank you, Miss McKenzie, for your presentation. It was really interesting to see the growing diversity of occupational therapy research, and it really also echoes the point from Marilyn's keynote this morning about us being an international professional community. And occupation is something that really transcends boundaries of country or nation. And it's something that we can bank on as occupational therapists. You also raised a very important point about staying true to our occupational therapy identities when we do our research. No, it's something that I would be applying myself in my research projects. So again, thank you very much for your presentation, Ms. McKenzie. To our delegates, if you have questions about Ms. McKenzie's presentation, please feel free to pop on over to our Q&A text box and post your questions there. We'll get back to you during our Q&A portion. All right. Thank you, Ms. McKenzie, and we hope to hear from you more later during our Q&A. Let us now proceed to the next presentation for this parallel session on occupational therapy research. Our second speaker is Sally Jane Uy of the Philippines. Sally is currently an associate professor at the College of Rehabilitation Sciences and Graduate School of the University of Santo Tomas. She has more than 20 years of experience as an occupational therapist in the clinical setting and the academe. She currently obtained her master's in educational management from the University of Melbourne under the Australia Awards program. Her presentation is entitled Infusing Service Learning into Allied Health Profession Curriculum, Perceived Enablers and Barriers. It is my honor to introduce Miss Sally Jane Uy. Please begin your presentation.
Okay, thank you. Let me share screen. Okay, can you see my screen now?
Yes, Sally, we can see it.
All right, thank you. Good afternoon to everyone. I'm here to share with you about my paper on implementing service learning in the Philippines, particularly from the experience of the University of Santo Tomas. With technological advancements like robots and automation taking over the jobs, these significantly affect how we interact and work. Though these emerging skills are highly needed, we equally emphasize the irreplaceable human skills, such as service orientation. This is especially true for allied health professionals. Humanistic elements such as care, empathy, and compassion will remain to be essential components of effective healthcare delivery system. Thus, as part of the university preparing the future healthcare professionals, it is important to explicitly develop these skills within their curriculum. What is service learning? Service learning is considered as one of the high impact teaching strategy used in higher education in the United States. Moreover, occupational therapy education considered service learning as one of its signature pedagogy. Meanwhile, Philippine higher education reform refocuses towards having universities connect more with communities and providing reciprocal service orientation for nation building, making an imperative push for service learning. Thus, service learning may offer this perspective in harmonizing the competing global, national, and health interests among Philippine universities. Defining service learning is quite complex, with multiple conceptualizations of this pedagogy. It may be as simple as Furkel's concept of service learning, which is an experiential educational approach that is premised on reciprocal learning. Or it can move towards more complex concepts developed by Bringle and Hatcher, which bring in concepts of reflective learning and community development. The most current and popular understanding of service learning resonates on learning and developing through active participation in thoughtfully organized service that is conducted in and meets the demands or the needs of a community and provides structured time for students to reflect on the service experience. In this presentation, two key concepts are highlighted: reflection on service experience as a pedagogical strategy, and reciprocity as a guiding principle for community partnership and learning. Literature has highlighted the benefits of adopting service learning in higher education, which includes an overall student learning and development of several humanistic skills for the health related professions, as well as discipline specific skills and generic health professional skills such as interprofessional practice and cultural responsiveness. Similarly, literature has shown enabling or support factors in implementing service learning, such as having educational and historical context as major drivers, change in the mindset for educational reform, design of service learning programs, and enabling processes by the institutions. The major barriers in implementing service learning in higher education include organizational culture and tensions, academic culture, the financial challenges, and the growing ethical concerns. These literature are mainly from westernized and developed countries like the United States and Australia. It remains a contextual challenge for countries in Asia and developing countries like the Philippines. Thus, this study sought to understand the enablers and barriers of implementing service learning in the context of a premier, private, Catholic, Philippine allied health profession education. The study utilized an in-depth descriptive qualitative design. Two sources of data were used. On one hand, semi-structured interview with key people were conducted. On the other hand, a document review of relevant organizational reports and plans on service learning was also conducted. These information were then coded and categorized into barriers and enablers according to the self-assessment rubric for institutionalization of service learning in higher education by FORCO. This framework looks into five dimensions, namely philosophy and mission of service learning, faculty and student support and involvement, community participation and partnership, and institutional support for service learning. A little background on the university. So, the University of Santo Tomas is located in the heart of Manila, Philippines. It is also known as the Royal and Pontifical University of the Philippines. It is a 400-year-old private Catholic university with over 20,000 student population. The study is limited to the College of Rehabilitation Sciences as one of the allied health professions. It has four programs: physical therapy, occupational therapy, speech and language pathology, and sports science. All of these programs are involved with rehabilitation of persons with disability, promoting their health and well being across all ages. Moving forward, the results of the study identified five enablers and five barriers. First, there is an implicit alignment of institutional mission with the values of service learning. While having compassion as one of the three core Thomasian values, the current service learning activities appear to be peripherally situated in the institutional goals and strategies, as evident in the students' extracurricular or co-curricular community-based activities, mostly voluntary in nature, with a few and selected teachers participating. Second, there is a beginning service learning groundwork being done. This is seen through the introduction of a community-based rehabilitation or CBR course into the OT curriculum way back in 2010. This offered a relatively new perspective on disability related health issues by putting the community as the focal point for disability prevention and health promotion activities. This CBR model also helped in developing a unique professional identity of occupational therapy within the Philippines setting. Third, service learning is generally met with optimism among faculty members. It also appeared that service learning is closely intertwined with our profession of helping people with disability, which shapes our unique professional identity as allied health professionals. Sorry. Fourth, there is a symbolic administrative support by forming the community development arm of UST. It is aptly called Simbahayan. It strongly reflects the Catholic values in educational reforms as well as in nation building. Lastly, there are already partner communities established through Simbahayan. For the college, it was easily identified as disability-focused community partnership in the rural and socioeconomically disadvantaged areas where access to therapy and health services are limited. This included public schools, rural health units, villages, and nonprofit organizations with disability-related concerns. On the other hand, five perceived barriers were also discussed. First is the fragmented view on service learning among students, faculty members, chairpersons, and administrative officials. This posed difficulty in harmonizing the student and faculty activities. Secondly, both faculty and students find some difficulties in engaging in service learning activities. For faculty members, community service is viewed as non rewarding and under recognized as a legitimate pedagogy. They are further pressed to balance between teaching, research, and community service. Third, there are minimal incentives available to both faculty members and students. For faculty members, community service is viewed as non rewarding and under recognized as a legitimate pedagogy. They are further pressed to balance teaching, research, and community service. Fourth, there seems to have limited reciprocity with our partner communities. The concept of reciprocity, where the control of resources is in the hands of those being served, is not evidently seen in the activities of Simbahayan, such as the dependence on the availability of students and faculty rather than the needs of the partner communities being prioritized. Moreover, its impact on the community vis-a-vis the learning of the students have yet to be explored. Lastly, there seems to have limited actual buy-in by administrative officials. Actual buy-in is an essential component of a successful service learning program. Budgetary restrictions and increasing bureaucracy may also have hindered service learning in UST. Essentially, there are four lessons learned here. One is the fragmented understanding of service learning is a typical characteristic of an early stage of service learning program development. Second, reciprocity as a key element of service learning needs to be overtly aligned with the Thomasian educational mission and disability-related health service learning initiatives. Third, faculty members need to learn and employ pedagogical reflection strategies on service learning activities that will infuse the humanistic skills of compassionate care into the curriculum. And lastly, Simbahayan may provide a broader range of pedagogical and research support towards institutionalization of service learning.
5 minutes left, Miss Wei.
In conclusion, the study has highlighted the multidimensional perspectives from the academic community and partner communities, which may affect the service learning implementation. Infusion of service learning potentially may support allied health profession curriculum for its emerging professional identity and role in enhancing disability-related health outcomes. Furthermore, infusion of service learning into the allied health profession may potentially lead towards the institutionalization of service learning not only in the College of Rehabilitation Sciences, but also in other programs in the university. Service learning may potentially be the vital link in fulfilling the Thomasian educational mission, but it may need to effectively organize and implement service learning to effect the authentic social transformation that the university hopes to achieve. Thank you very much for your attention.
All right. Thank you so much, Sally, for your presentation. So, as someone who is also affiliated with a similar service learning program, I can truly relate to some of the points that you raised in your presentation, and especially in the sense that there really is a need for service learn for to recognize the role of service learning as not something that is exclusive from teaching and research, but as something that can actually complement the strategies that educators use in teaching our and forming our future occupational therapy professionals, and also by researchers in in helping their projects become more grounded and really reflects what is happening on the ground with our patients and in our community. So thank you, Miss Sally, for your presentation. If you have questions for Sally, please pop into our Q&A and send in your questions, and we'll get back to you during our question and answer portion. All right. Thank you so much. Okay. Moving on, let us proceed to the last but definitely not the least of our presenters for this parallel session on occupational therapy and research. Our third speaker is Dr. Hee Kim of South Korea. He is an assistant professor at Konyang University, Republic of Korea. She earned her master's degree in occupational therapy at Boston University and her doctorate degree in occupational therapy at Yonsei University, Korea. She has clinical experience in the rehabilitation setting. Her presentation this afternoon is entitled The Effects of Model of Human Occupation Based Home Modifications on the Time Use, Occupational Performance, and Activity Limitation in People with Disabilities. It is my honor to introduce Dr. Hee Kim for our third presentation. Dr. Hee, I will now cue your presentation.
Good afternoon, OTs. I'm delighted to be here at APOTC 2020. I'm Hee Kim, an associate professor at Konyang University, South Korea. I would like to present this presentation entitled Effects of Model of Human Occupation-Based Home Modifications on the Time Use, Occupational Performance, and Activity Limitation in People with Disabilities. Presenters are as follows. The oral presenter, Hee Kim, is an associate professor and chairperson at Department of Occupational Therapy, Konyang University, Korea. She is one of the A1 Korean instructors and a recipient of a research grant from the National Research Foundation of Korea. Co-authors, Yeji-jo is a student in doctorate course, and Hyuna Song was a student in bachelor's course of Konyang University. Our research was based on the model of human occupation, which most of you are familiar with as MOHO, and we will refer it as MOHO in this presentation. MOHO explains that an individual's occupational behavior is the result of interactions among the three components: volition, habituation, and performance capacity. And these interactions happen in the environment that the person is in. Based on this model, practitioners can proceed with client-centered home modifications from the perspective of the client, occupation, and environment, allowing the clients to actively participate in all of their living spaces. In previous studies, modifying the home environment reduced the difficulty and burden of the client in participating in diverse occupations by improving the physical environment to achieve a subtle balance among the person, environment, and occupation. Studies have attempted to improve one's occupation in people with various types of disabilities by applying MOHO in modifying the occupational environment. However, limitations were found in participating in diverse activities because of imbalanced time use in each occupational areas. Especially occupation implies meaning to life and its inseparable relationship with temporality has been emphasized. Also, research was insufficient on comparing the intervention effect with another commonly used intervention and conducting the study on community dwelling people with disabilities resulting from diverse diagnoses. Moreover, studies were lacking on applying multiple assessment tools to provide appropriate intervention to individual homes in their daily lives. To, to apply suitable intervention for each individual, studies emphasizing the intervention process appropriate for the client's context are needed. The purpose of this study was to compare the uh, effect of the intervention providing home modifications and assistive devices based on MOHO theory with home exercise on people with disability in time use, competence and values of occupational performance, and activity limitations. This is the whole process of our study. And a total of 38 participants partook in a randomized control trial, 20 in the experimental group of home modification, and other 18 in the control of home exercise. Occupational questionnaire OQ was used to evaluate time use, and occupational self-assessment OSA was used to identify self-awareness of performance. Activity limitations measure active limb was used to assess the degree of activity limitation. Both experimental and control group were intervened with a total of 8 sessions, and each session was once a month for an hour. Over the same study period, participants in the intervention group underwent a modification of their home environment that limits their activities and participated in activity training using assistive devices, while those in the control group received a home exercise program using brochures and videos according to their functional level. During the evaluation and intervention period, occupational therapists working in the community and fieldwork 1 level OT students who received 4 hours of training regarding environmental modification and assistive technology in a class participated and assisted. A committee composed of a professor in OT, researchers, 3 OTs, and 3 project managers at health centers suggested the direction of each intervention through 4 case conferences. The main contents of the intervention based on MOHO is in the table left. As you can see, diverse OT areas like ADLs, IADLs, work, leisure, rest were targeted as the intervention area, and a lot of AT devices regarding that and home modifications were made. The 8 sessions processed with the experimental group is in table right. Before the intervention, the homogeneity test did not show any significant difference between the groups. Participants completed this study were 35 in total, 17 in the home modification group and 18 in the home exercise group. There were a total of 3 dropouts in the experimental group, and 2 of them changed their mind of participating and letting people in their homes, and one of them was hospitalized during the intervention. The median age of experimental group was 61.47 and control was 64.66. 10 females and 7 males were in the experimental group, while 10 females and 8 males were in the control. As for the type of disability, 12 were diagnosed of CVA and 5 were arthritis in the experimental group, whereas 15 were CVAs, 2 were arthritis, and 1 were spinal cord injury in the control. As for the type of living situation, 7 lived alone and 10 lived in a single family home in the intervention group, whereas 10 lived alone and 8 lived in a single family home in the control. As for the type of residence, all of the participants lived in apartments. The intervention group who received environmental modification and assistive devices using the MOHO used significantly more time in ADLs and leisure after the intervention. This is consistent with a previous study by Stark that showed an increased ability in the ADL after environmental modification. By modifying one's home and training activities using assistive devices, unnecessarily long rest hours such as watching television decreased. Proper rest and sleeping hours after intervention provided stability in participating in ADLs and leisure. The control group did not show any significant changes after the intervention. When compared the difference between 2 groups after intervention, working time of the control increased significantly after intervention. This was due to the fact that one of the participants in the control started a full-time job during the intervention. The home modification group showed significantly increased self-awareness regarding the competence of occupational performance after intervention, and the improvement was significantly more compared to the control. The study by Rayleigh and Hines showed increased ability through existing remedial approach. However, participants in our study were chronic patients with unlikely functional recovery, and we were able to increase the self-awareness regarding their own ability by providing the opportunity to participate in activities through a compensatory approach. Also, Arsman and Mosley support that client-centered occupational therapy compared to simple exercise intervention enhances physical functions and occupational performance. The control group significantly improved the value of occupational participation after intervention. Simple home exercise program can increase one's value on occupational performance, and this shows OTs should consider both exercise and client-centered home modification. Both home modification and the control group significantly um, uh, decreased in activity limitation after the intervention, and the difference between groups was not significant. This suggests both interventions are efficient enough to eliminate limitations and boost one's activities. Using the interactions between human and environment for environmental modification increase the time used in occupational participation and competence to perform occupation in people with disabilities. By applying MOHO theory to evaluate and modify one's home environment, we could comprehend the lifestyle of clients and suggest opportunities to actively participate in ADLs. Client-centered occupational therapy through home environmental modification encourages participation in ADL and elicit positive awareness of the occupational performance. Adapting MOHO theory to enhance activity participation will contribute to enhance the quality of occupational therapy service in community settings. I hope you enjoyed my presentation, and I'm very thank you for your full attention, and I hope you have a wonderful remaining time in this conference. Thank you.
All right. Thank you so much for your presentation, Dr. He. I found it really striking how truly um, client centered occupational therapy interventions can really meaningfully improve or support the occupational performance of persons with disabilities. I think it really highlights the unique and utterly invaluable role that occupational therapists have in helping those with disabilities. So thank you so much for highlighting that in your presentation. At this point, we will have our question and answer. So if we can have our presenters to turn on their videos and join us here on stage. All right. I think Miss McKenzie is will follow. We have some questions on our chat, and the first one is addressed to Sally. All right. So let me show it on screen. So hi, ma'am. We want the Miguel De Leon wants to ask how you think we can better get the communities and the students to better buy in to the concept of service learning. Since, as you mentioned in your presentation, that it has to be reciprocal. Miss Sally.
Okay. Yes, definitely a buy-in of the program is very essential for a successful service learning program. So one of the things that we need to build is relationship with the communities. Is really understanding what we can address in their community. So aside from looking at their needs, it's also looking at what they can contribute to the learning of the students. So they are not just a recipient of these services, but also they are learning, or they're contributing to the learning of the students as well. So building those relationships are very essential. Another strategy to look into is doing it from an asset based approach, meaning you look at what is available in the community, what we can contribute from the university or from the education sector, and then take it from there, so that you are working on what they already have and building it from there. And if they see the effect, the impact on their community, then we need to celebrate that as well. No, not just because their lives have improved, but because they have also contributed to the learning of our students. So that's also another important aspect to look into to improve or increase their buy-in to the service learning.
Thank you, Sally, for answering that question. We have another one for you here. Um, how are reflection strategies concretely implemented at the student level under the service learning framework?
Hmm. There are several strategies, models of reflection that can be used as a teaching strategy. You have Gibbs, you have Royce, you have deal model for reflection. But what I like is a simple one, and this is what I also use in my classes. It's simply as simple as what did they experience? So what? What is the impact on me, on my learning, on the community? And then now what? What will I do after reflecting and learning about these things? What actions am I gonna be taking in the future? So these three questions, no, are very basic questions, but it is becoming like ingrained in the students when they start reflecting. It's not all about emotions. It's also breaking it down to what is meaningful to them, and then propelling them to take action based on those reflections.
All right. Thank you, Miss Sally. We also have another question for Dr. He. Dr. He, thank you for your interesting study. Lim Sok Mimwe is curious how you manage to split into two groups. Example, those prescribed with device, wouldn't they need exercise to guide them on how to use? Or how do you stop the exercise group from getting modifications?
Thank you for the question. And how did we split the two groups? The we kind of use random selections for each group. So if one a person um, um, starts participating, we flipped coins to um, g- get him a group, whether it is um, environmental modification or exercise. And most of the we didn't mention in the presentation, but most of the participants were chronic patients. Their onsets were more than 10, mostly almost like 8 or 9 years, or some of them more than 10 years. So um, they had uh, a lot. They didn't have a lot of active engagements in participating in any of them initially, but also the when the question mentioned about whether the um, with how did we control the people not getting the exercise when they are in AT group and not getting modifications when they are in exercise group. Uh, Most of them were they didn't have a lot of um, economical support outside of community service. They didn't have much money on their own, so um, they couldn't get AT or modifications on their own if they are not in the group. And people who were not in the exercise group, the people who were in AT and modifications group, they didn't have a lot of active motivations to get exercise on their own. So people, participants, just, mostly they just did uh, what they are told to. Um, I hope that I answered the question right.
Thank you, Dr. He. We've got another question for you here for Dr. Kim. Miguel wants to ask if you think a MOHO-based modification approach will be applicable to tele occupational therapy setting. What are your thoughts on this?
Well, on tele-occupational therapy, I also, after the COVID-19, I am also doing this part as my research. And we did
one trial on just one group um, thing for our community OT. And um, about the tele OT, which you can call tele rehabilitation, my thoughts are very, my experience with it was not very successful. So I don't think most of the um, I think most of the OTs will agree with this, but the tele OT or tele rehab is much less effective compared to real visit or real meeting on an actual reality. So I think we could apply it, but I don't think the efficiency, effectiveness would be as much as the real um, um, reality meeting on the real setting.
All right. Thank you, Dr. He. Maybe we have time for one or two more questions for Ma'am Sally. Arden wants to ask the level of involvement that service users or the people in the community in service learning. Like, is there an opportunity for service users to give feedback or share insights with the students?
Yes, definitely. There should be a feedback mechanism made available to our recipients. No? So they are not just looking at service provision aspect, but also how they are learning from the students with the programs or the activities that were being provided. In some service learning programs, the grades of the students are based from the recipients. So it's the service users who will be grading the students. So it's not the faculty or the teachers doing the grading.
All right. Thank you, Sally. I hope that answers your question, Arden. We have one question for here for Miss Mackenzie, but we're just having trouble bringing her up to the stage. Okay. Um, Maybe Miss Mackenzie, you can also answer in the chat our question from one of our participants in this parallel session. I've added it here to the chat so you can maybe address it as well. All right. Any other questions? Okay. Mhm. All right. So, unfortunately, we won't have time anymore um, to go over the rest of the questions in our chat in our Q&A box, but you can send them to our presenters and speakers via direct message on their inbox or through the chat so they can help address these questions for you. All right. We've now come to the end of this parallel session on occupational therapy research. So we've had a very interesting and lively discussion. And we thank our speakers, Ms. Mackenzie, Ms. Uy, and Dr. Kim, for sharing your knowledge and expertise to us this afternoon. Before we officially end, we would like to present the certificates of appreciation to our speakers. Let me just pull it up. The certificate reads: the Philippine Academy of Occupational Therapists and Learning Aiders present this certificate of appreciation to Lynette McKenzie, Sally Jane Uy, and Dr. Hee Kim for being an oral presenter during the 7th Asia Pacific Occupational Therapy Congress hosted by the Philippines via AirMeet on November 22, 2021. Signed, Roland Lyle Duque and Arcel Rosario Gozon, co-conveners, and Dr. Anthony Gresha, President of the Philippine Academy of Occupational Therapists. Let's give them a big hand. All right. Once again, thank you so much, everyone. And especially to our speakers for being with us in this parallel session. And we also thank everyone for your active participation in our session. We'll have a quick afternoon break, so feel free to grab a quick snack or a cup of coffee or tea. And we hope to see you back for our next set of presentations on occupational therapy research at 3:30. All right. Thank you, everyone.
Thank you.
Thank you.